And now it is time to welcome our first guest in a segment we call Dr. Dog Mom. And Dr. Renee Schmid has been with Pet Poison Helpline and Safety Call International since 2013. She received her BS in Agriculture and Doctor of Veterinary Medicine degrees from Kansas State University. Dr. Schmid has worked as a small animal general practitioner and has also received additional clinical training through an anesthesia residency. Over the years, she has authored many papers and studies in the realm of toxicology. Dr. Schmid is a diplomat of the American Board of Toxicology and the American Board of Veterinary Toxicology. Wow, that is quite a resume. Welcome to the show, Dr. Schmid.
Hi, thank you so much for having me.
Well, I know you obviously have a love and joy for animals, but when did your love for them first spark? How did that come about for you?
Yeah, I think my story is very similar to most other veterinarians or veterinary professionals. I've always had a love of animals. Really enjoy all types of animals. Dogs are really probably the ones that pull at my heartstring the most. And I didn't really know I wanted to be a veterinarian until I was in junior high. And I had a pet, a basset hound who developed lymphoma, a form of cancer. And it was at that moment that I just decided that's what I was going to commit my life to, was to help animals.
Yeah, it's amazing how those tough experiences really do shape us.
Definitely.
I imagine for you, your personal experience helped you even bring that much more compassion to the table when you're working with people who are in very tough situations, either emergency situations or looking at the potential loss of their animal.
Yeah, absolutely. And one of the things that I've learned kind of throughout my career is when you hear people who say, gosh, I want to be a veterinarian or I want to be a veterinary technician because I love animals. It's so much more than that, because there's a human that's attached to all of those animals. And when they're a family member, as mine have always been, it's something that's really important to be able to communicate with those pet parents or pet owners, and to really talk with them and know that you're really having a huge impact on the quality of their family life through that particular pet.
That's a beautiful mindset and outlook, because I really feel like time is one of the greatest gifts that we can give people. And I know as a busy professional, there could be that temptation to, oh, the clock is ticking and the people are waiting. But for you to take that time to really enter in and give your heart and your full attention to who you're working with is a really beautiful thing.
Yeah, absolutely.
So can you explain to our dog moms who may not know, what is veterinary toxicology all about?
Yeah, so veterinary toxicology. So we're all veterinarians, and we have specialized or kind of devoted our career to toxicology itself, which is really the study of poisons, as an easy way to say it. And so while I've definitely been in general practice and emergency work and clinical practice, what I have done over the last 10 years is devote my profession to learning just specifically about those things that are toxic to animals, and specifically how to treat them.
That's such a noble cause. It's so important. And when you're in an emergency situation, we need those who can give us advice and help educate us even before we get to that point, really. But share with me, what is the overarching goal of the Pet Poison Helpline? Tell us about what makes you get excited each and every day when you go to work.
Yeah, you bet. So really our overarching goal is to be that trusted resource in veterinary toxicology for pet parents and for even producers, large animal owners alike. And there is so much information that's out there and different ways to receive that information. It can be very difficult to determine what's true and what isn't true. And so we want to be that trusted resource to know that if we're sending information out, if you're getting information from Pet Poison Helpline, you can rest assured that that's the accurate information that you're getting for your pets, so that you can be educated on the things that are potentially poisonous or detrimental to a pet and know how to take care of them.
I know that there are a lot of deadly poisons out there. What are some of the most common poisonous items that dogs come in contact with based on your experience?
Every year we do a top 10 toxins list, and we put it out the beginning of each year. And I would say probably every year for the past 20 years that we've been in an established business, that chocolate's always the number one toxin. We don't think about chocolate a lot as being that bad, because if you're like me, we love to eat chocolate, and we usually often have it around in our household. But animals process it differently. It works differently in them, and they're much smaller than we are. And so it can be really problematic, but it's always our top one. And then if you think about other household things that are fairly common around to have in the house. So grapes and raisins are a really common toxin that we see for our dogs. Xylitol containing products, that's definitely something that can be very problematic, but also very common to see in the household. And then we think about medications. So ibuprofen, a very common pain reliever that's in many households. We'll have a lot of animals that get exposed to ibuprofen. We'll also have them get exposed to mouse and rat baits. And so that's a very common one as well. And then other just dietary supplements that people may be taking for their own health benefit.
Super helpful information. You know, you mentioned chocolate, and I thought, yeah, I know from experience. I had the sweetest cockapoo, Ella. She was with us until, man, I think she ended up passing away at 18 years old. So she lived a full life. But a few years prior to her death, she was like a bloodhound when it came to chocolate. She just had this love for chocolate. My father-in-law was visiting from St. Louis, and he had chocolate X-Lax in his suitcase, tucked away in a compartment. She went with her little mouth, unzipped the compartment. I'm like, are you kidding me? Went into his suitcase, pulled it out. And needless to say, Dr. Schmid, we ended up at the doggie emergency vet situation, and she had to have her stomach pumped. But I mean, you got to watch it, because those dogs, boom, they can get right on it.
Boy, you know, they have a great nose for a reason. And so just their natural instincts to sniff things out. It's in chocolate. Who doesn't like chocolate? The animals like it just as much. And even cats, you know, for those of us who have cats in the household as well, it's a very common substance for them to get into as well. But dogs for sure love chocolate.
Right. My father-in-law said, I just didn't even think it was inside my suitcase, but you better believe we all think about it now. But Dr. Schmid, I was reading this crazy article about a dog that ingested, listen to this, maybe you've heard about it, 1.5 pounds of brownies. I mean, that seems like a bad thing. I mean, a really bad thing. And not just brownies, okay, pot brownies. So marijuana in the brownies. I mean, this is crazy. Is this becoming more common now? I'm just thinking with the legalization of marijuana in many states. What are you hearing and seeing?
Yeah, for sure. That actually was a case that we managed, and that we helped the pet parent as well as the veterinary clinic on with their treatment. It was a really interesting case, because what started out was this dog got away from its house, and he was out wandering the streets, wandering the neighborhood. And when he was finally found by a family member, he wasn't able to walk. He was really lethargic. They were afraid he had been hit by a car, and they got him into the veterinarian, and the veterinarian thought, gosh, he really looks like he's gotten into maybe some type of marijuana. And so they induced vomiting with him, and they found he brought up this 1.5 pounds of brownie substance material that had marijuana scattered in it. So it was really an interesting case, because who knows, someone must have had it on their back porch or sitting out somewhere, and the dog ingested it. But we definitely see an increase in marijuana and THC products now. I think as each state becomes legalized in more and more states, it's become a little bit more acceptable to admit that there is marijuana or THC in the area. I know when I was in practice, there weren't any states that had legalized marijuana or THC. And so when you went into a room and you said, gosh, are you sure this dog didn't get into, some type of marijuana? And they'd say, no, 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 no. And you would treat them anyways for marijuana. Now it just seems to be more readily acceptable that they could have gotten into that or been exposed to it. And so we've actually seen over the last several years about a 700% increase in our calls with marijuana. And so it's just really been a very high increase, both with medical marijuana, both with recreational, any type of THC product or edible that's out there as well.
Yes. It's just, that story about the brownies is just, it's not funny. There is nothing actually funny about it other than it's just so bizarre. But
Right.
thank you for sharing that insight with us. It's just helpful for us to know and for us to be aware of what really is happening and how we can better protect our dogs and do the right thing for them. Um, Going from marijuana, talking about THC, I do want to bring up CBD, which is another different issue, but we've had guests on the show that have varying views about it. So I'm wondering where you land when it comes to CBD and dogs.
So CBD itself isn't really the issue or the problem. What becomes the problem is that a lot of the CBD products aren't what we consider pure CBD. And so they can have a trace or a small amount of THC in them as well. And THC is that property in the marijuana plant itself that causes what we call psychotropic effects, or that mind altering effects. And so when we have an animal that gets into a CBD product that also contains THC, that's where we start to see the issue. And animals are much more sensitive to THC than humans are. And so even a really small amount that maybe a human could take that type of a product and not notice any differences could really affect very impactfully and negatively these dogs that get into those types of products.
Yeah. So again, just the purity, knowing where it's coming from, and proceeding with caution. That's very important. Now, Dr. Schmid, I know that you care a lot about giving back, and you're an advocate for the AKC Reunite program. So can you share with us what AKC Reunite is all about?
You bet. So AKC Reunite is a microchip program. And so they have microchips and I would definitely encourage everyone who has a pet to have them microchipped, even if they rarely spend any time outside of your arms or out of your home, because you never know when that situation is going to come up where they might just sneak out the door and get scared or startled and then be lost. But they have it's a microchip program. And so people who have that microchip and have that program, they're able to call our nurse line that's associated with Pet Poison Helpline and talk to one of our veterinary technicians to get general pet health advice. And then if they do get into something that is toxic or a potential toxic exposure, that gets transferred right over to us with Pet Poison Helpline. And so we can manage that at no charge for that pet owner.
That's a beautiful partnership. Love that. Technology is just changing and advancing all the time. How have innovations in the telehealth field, how have they been streamlining or improving what you do?
Yeah, it's a great question. And it's something that is a little bit kind of good and bad. It's exciting and a little bit scary at the same time. With technology and advancing, we're able to reach more pet parents. We're able to help more animals. Along with that technology, however, comes with a lot of different resources or different types of companies that are coming in and trying to kind of monopolize or to take advantage of pet parents in that way. And so then it can also be kind of disseminating wrong information. And so while we found that it to be extremely useful in helping us to reach more pet parents so that they can adequately and appropriately treat their pets. It's also something that is a little bit alarming in the sense of where do I find that right information, and who do I trust to get that information to me so that I can make that right choice for my pet.
Yeah, great input. You know, a lot of dog moms, all dog moms really, myself included, we're uber concerned about the safety of our pets. So Dr. Schmid, can you share with us just some basic tips on maybe the top things that we should be doing to keep our pups safe?
You bet. And I think about the home environment and think about medications and supplements. Many of us think that over-the-counter medications or dietary supplements, including vitamins, aren't problematic because we take them so readily and they generally have a good health benefit to us humans, but they may be quite problematic in pets. And so I always encourage people to place their medications, their dietary supplements, no matter how safe you may think that they are, keep them behind a closed door. So if they can be behind a cabinet door, if they can be in a room that the animal doesn't have access to, anything like that can be very helpful. The other thing to think about is if your pet is taking medications, make sure you keep it in a separate area. My mom is a great example, and she probably wouldn't appreciate me using it, but I think it's important. She kept her medication and our pet's medication in the same spot.
Oh.
And so she inadvertently gave our dog her medication. And so those are things that happen. We get a lot of calls with that, and that can be really detrimental to that pet. I would also say on the line of medication, take that medication in a room that's closed off to your pet at the time. So shut the door so that when you're taking the medication, if you've got that little dog who loves to be at your feet all the time, if you were to drop that medication, they can't sweep in and take it. Make sure you're not setting medications out on the dinner table or the coffee table or nightstand to take it where they can get it. But then also just think about toddler proofing your house or baby proofing your house. That's what we need to do for our pets as well. So keeping cleaning products out of the way, keeping foods out of the way that could be problematic. So especially our grapes and raisins that are small and can be sitting out and they can get into that. Any type of product that might contain xylitol, making sure that that's well out of reach for each pet.
All right, incredibly helpful and important tips. Okay. So we are going to expand on this in a fun way, and we'd like to do a little lightning round, so to speak, where we tackle some of the trending myths regarding pet safety. Are you ready, Dr.
I'm
Schmid?
ready. Let's do it.
Okay, I know you're up for a good challenge. Here we go. If a dog ingests something toxic, is it best to induce vomiting?
No. And the reason for that is because some things don't need to be vomited. We always know the quote of the dose makes the poison. So even if they get into something that they shouldn't, we may not want them to vomit because they don't need to, or it may actually cause more damage coming back up than if it were to go pass through.
Is it okay to use hydrogen peroxide to induce vomiting?
Only at the direction of your veterinarian or a toxicology expert, because there's definitely a dose that can be safely used in certain situations.
Okay, so what about salt or mustard to induce vomiting?
No, I would avoid all of that. Salt can cause high sodium levels, which can be toxic, and mustard is just not going to be effective and very irritating.
And what about pain relievers like Aleve? How dangerous are those for our dogs?
Aleve is one of the most dangerous pain relievers for a dog to have. I would not recommend giving any type of human approved pain reliever for a pet because their margin of safety is extremely low. I would work with a veterinarian on pet approved, FDA approved products.
Okay, now what about macadamia nuts? Are macadamia nuts toxic to dogs?
They are toxic to dogs, and it's really interesting because we're not sure why, but they can cause body tremors, they can cause joint pain and muscle stiffness to occur, And they can also cause pancreatitis because of their high fat content.
Okay, this is kind of a silly question, but we have to ask it. We can talk about it. All right, is it toxic for a dog to eat poop?
Not their own poop, probably, unless they got into something toxic and it's being defecated out. Not the funnest question to answer when someone's eating breakfast or lunch, but if they get into a human stool, it can be problematic if they're on medications, depending on how it's excreted in the body.
There you go. And it's just plain gross, but
it is gross. For sure.
You are amazing and you are a trooper. All right, what about moldy foods? Are they toxic to dogs?
Yeah, moldy foods can be really damaging. So they can contain what's called tremorgenic mycotoxins. And what that is it's a toxin that can cause body tremors and neurologic signs to develop and can potentially be fatal.
All right, super helpful. Dr. Schmid, you survived the lightning round. Woo! Thank you so much.
You bet.
All right, so what's the best way for dog moms to contact the Pet Poison Helpline if they think their dog may be in an emergency situation or if they need some helpful information?
Yeah, so we have two great options. One is through our website, petpoisonhelpline.com. And there's a poisons list that you can look up different information on different things your pet may have gotten into. You can also call us at 1-800-213-6680. We're open 24 hours a day, 7 days a week. We never close.
Wow, you never close. That is dedication. Dr. Renee Schmid, thank you for all that you're doing to help keep our dogs safe and to help keep them living and thriving.
You bet, and thank you for helping us to spread the word.
Thanks so much for watching this Dog Mom News clip. Be sure to like, comment, and subscribe to our YouTube channel for more awesome and informative Dog Mom News content. And while you're at it, ring the bell so that you can find out about more content in real time. You don't want to miss it. Thanks for watching, everyone.